Good morning, everyone. Thank you for joining to this presentation. It's great to see you all. But before we start our presentation, let me introduce ourselves. My name is Daniela Putri.
My name is Amanda Putri.
And my name is Nurlisa Gunawan.
Okay, everyone. In this presentation, we will discuss about women health. Research on women health is important to be investigated more deeply. From several articles that I read while I doing a research, it turns out that the women are more at risk of developing this disease than men. Women are more susceptible to disease such as you can see this one, autoimmune disease, cancer, cardiovascular disease, depression and brain disorder, diabetes, and obesity. Therefore, women are encouraged to pay more attention to their own health. I will give you a common example that is found in our society. The namely is obesity. You can see in PowerPoint, this is obesity data in the graph. Therefore, women are encouraged to pay more attention to their own health. It is currently estimated that more than 100 million people worldwide are obsessed. And this number is still increasing rapidly. If this situation continues, by 20 to 30, it is estimated that 100% of the population of United States will be obese. This is caused by lifestyle, improper diet, and lack of activity. Most of us prefer to drink a soda and eat the junk food. And that's the main reason people get fat. To prevent this from happening to women, we can start by adopting a healthy lifestyle. I will give you the solution to susceptible to disease. The first one is doing sport and or fitness or yoga or something like that. The second one is go on diet, the health diet, of course. Uh, Third is a health lifestyle. And the last one is smooth menstrual cycle. This is the important things when you are a woman. So the next part will be explained by my friend Amanda.
So I want to talk about menstruation in women. First, about uh, what is menstrual period. Menstruation or period is normal vaginal bleeding that occurs as part of a woman's monthly cycle. Every month, your body prepares for pregnancy. If no pregnancy occurs, the uterus sheds its lining. The menstrual blood is partly blood and partly tissue from inside the uterus. It passes out of the body through the vagina. And what does a normal period look like? The truth is, normal is different for everyone. Some people have short life periods that arrive like on schedule every 28 days, while others have heavy ones that show up whenever they want. And how long does a period last? Most periods last from about 3 to 7 days. It's totally normal to see a mix of period colors down there, from bright red to dark brown and everything in between. This is the menstrual cycle. First, we got menstrual phase. Menstrual phase begins on the first day of menstruation and lasts till the fifth day of the menstrual cycle. And the second is follicular phase. This phase also begins on the first day of menstruation and but lasts till the 13th day of the menstrual cycle. And third is ovulation phase. On the 15th day of the cycle, the pituitary gland secretes a hormone that causes the ovary to release the mature egg cell. And last is luteal phase. This phase begins on the 15th day and lasts till the end of the cycle. This is menstruation symptoms. In addition to bleeding, 90% of people who menstruate say they experience various symptoms. Food craving are one common symptom, and breast tenderness is another common period symptom. It can peak in the days just before menstruation starts. Meanwhile, period pain, also called a cramp, is another common symptom. More than half of menstruating people experience some pain around their period. A painful, irregular, or heavy period affect up uh, 14% of females in the childbearing years, estimates womenshealth.gov. Moreover, a 2012 study found 32 to 40% of people who have periods report this pain is so severe they have to miss work or school. And this is the most common period-related health condition. And first is endometriosis. Endometriosis causes uterine tissue to grow outside the uterus. This can lead to severe pain, cramping, and heavy periods. And second is menorrhagia. Menorrhagia is very heavy menstrual bleeding. Typical periods produce 2 to 3 tablespoons of menstrual blood. People with menorrhagia can produce more than twice that amount. And third is premenstrual syndrome or PMS. This is series of symptoms that typically occur in a week or two before the start of a period. Symptoms can include fatigue, bloating, irritability, and PMS affects as many as 3 in 4 women, reports womenhealth.gov. And the last is premenstrual dysphoric disorder or PMDD. PMDD is similar to PMS but is more severe. It can cause depression, tension, severe motive, lasting anger, and experts estimate about 5% of women experience PMDD.
Okay, thank you, Manda. The next part will be explained by Nurul.
Okay, I wanna tell you about anorexia nervosa. First is, what is anorexia nervosa? Anorexia nervosa is a psychological illness that has devastating psycho consequences. It is characterized by low body and body image distortion with an obsessive fear of gaining weight, which is manifests itself through depriving the body of food. It often coincides with increased levels of exercise.
Yeah.
Stop dulu, Manda. And in second point is diagnosis of anorexia. Diagnosis of anorexia nervosa requires each of the following criteria. One, restriction of energy intake that leads to a low body weight given the patient age, sex, developmental trajectory, and cycle health. Intense fear of gaining weight despite by underweight, distorted perception of body weight and shape, or denial of medical seriousness of one's low body weight. And the last point is certain antidepressant medications such as selective serotonin reuptake inhibitors might be used to help control anxiety and depression. And maybe psychotherapy. This is the type of individual counseling that focuses on changing the thinking and behavior of a person with an eating disorder. That's for me. Thank you so much.
Okay, thank you, Nurul, for your presentation. So, the conclusion for the meeting is the important things that women should pay attention about their woman health because health is very important and expensive. And that brings us to the end. Thank you so much for your time and attention. Have a great day.